Hi, I'm Dr. Robert Eckel. I'm a professor of medicine at the University of Colorado Anschutz Medical Campus in Aurora, Colorado, which is where the medical school is. And I'm a basic scientist, but as a clinician, I'm a preventive cardiologist, even though I'm an endocrinologist. So my talk here this afternoon related to, can the LDL cholesterol get too low? And the basis of that talk is we have a whole new class of drugs, the PCSK9 inhibitors, that lower LDL cholesterol a lot. These drugs lower it up to 60%. And many times when we treat people with these drugs, their LDL cholesterol can not only be under 40, but they can be under 25 milligrams per deciliter. So the question comes up about two things. Is LDL cholesterol still a surrogate for atherosclerotic cardiovascular disease at very low levels of LDL? In other words, can we translate levels of LDL to heart attacks and stroke or death from heart disease? Or is in fact there a plateau of lowering where in fact going below that doesn't provide any additional benefit? And then secondly, what is the harm of going very low, getting LDLs to 10 or to 15? We're born at levels of 25 to 30, but we have those rise very early in childhood when we're eating the kind of diet we're eating. So the issue right now is if we look at genetic conditions where LDL is very, very low, there doesn't appear to be any harm except for malabsorption of dietary fats. So if those fat-soluble vitamins are given in alternative manners, ultimately we can prevent any of the complications that relate to having a very, very low level of LDL. But with the PCSK9 inhibitors, these are people that are used to very high levels or moderately high levels that now have very low levels. From the clinical trials that have been done thus far, we don't see any evidence that reducing LDL cholesterol to under 25 repeatedly is associated with harm. But I think it's important to realize these trials have been relatively short term, up to 18 months. But treating a patient for 10 or 20 years with these drugs, lowering their LDL cholesterol so much, may in fact provide some harm that we are not yet able to track adequately over the short term. So in summary, lowering LDL further is going to be beneficial, I think, for heart attacks and stroke. Question is, at what level is that benefit going to cease? In other words, is it a plateau? And secondly, getting very low levels, is that long-term safe? Right now it looks like it, but we need long-term studies to really be certain of that outcome.